student. I'm a final year student from St. GS Medical College. Just the other day, I was examining a patient in the surgery ward, and it was a case of a swelling. So the patient, she had been admitted. Okay. The patient had been admitted around more than 2 weeks back, and what happened is she was a battery of tests. So without telling her what was happening to her, and she just thought it's a small swelling, it's very inconspicuous and it's not a big problem for her, and she just told me how frustrated she was. So immediately they sent her for a PET scan, which was around 5,000. She did not have the money, so she just left the ward. And turns out from the report, it turns out she had it was a malignancy because of an unknown primary. So they couldn't trace her back, and she just left. So this is one of the situations encountered. Other one which I encountered was a few weeks back. There was a patient who had in the medical ward who had developed diffuse rash all over his body. So this was because he had self-prescribed himself with some antibiotics and for a urinary tract infection. So this was, again, he had read it up on the internet, and that's how he'd come. So why do we come across these situations? It's basically because of lack of adequate counseling of the patient, and both the doctor and the patient is to be blamed. So the solution to this lies in information therapy. As my colleagues have already said, information therapy is providing the right information to the right person and at the right time. So the right information, which is evidence-based, approved by experts, and it's also reference. And the right person includes either the patient or the patient's caregivers or the family who share the information and who take part in the behavior change. And also it occurs at the right time. So it should be just in time to help the patient make a better decision to improve his health behavior. So the benefits are that the benefits of information therapy include that the patient can do self-care as much as possible. It also gives them, it is also a very safe option. It equips them with a veto power so that they can say no to medical care and also avoid any unnecessary surgery or any unnecessary testing. It improves the efficiency of services, so the cost to benefit ratio is improved. The proficiency of the doctors, so the doctors are always kept on their toes. Also patient safety, because any side effects or contraindications are already told to the patient by the doctor. And there's health actualization, which means that there's a shared decision making which aligns the needs of the patient with that of the treatment plan. So expensive treatment is avoided. So how can this be incorporated in the medical curriculum? It starts they say that every journey begins with a small step. So it begins with involvement of the undergraduates in the inculcation of by inculcation of information therapy in the medical curriculum. These form the building blocks of the healthcare system. So it is of utmost importance that these young minds are involved in the process. So how can it be done? It can be done primarily through seminars, workshops, any discussion workshops, or any case discussion and problem-based finding solutions to the problem. Or it could also be done practically, which I will elaborate. Seminars can be used to first of all to inform the students on how to improve their communication skills. So William Osler has rightly said, listen to your patient and he's telling you the diagnosis. As a student, I have often seen my seniors, they have in a public hospital like KM, they have always, the registrars, they've behaved rudely with the patients and haven't given them, they don't think it's important to inform the patient because of so much workload. Also in a lot of private clinics, the doctors presume that the patients are from an affluent family, so they are well informed. They often use a lot of medical jargon, which they presume that the patient will understand. So what they don't realize is, if they communicate effectively, they could reduce a significant workload of their shoulders. So the effective communication starts with adapting to the teaching to the patient's level of readiness, his cultural beliefs, his experiences, and they should also involve the patient in the discussion so that they can reach a common goal. And this is how the doctor motivates the patient to adhere to the therapy. At the same time, the doctor must provide an opportunity to the patient to make sure that he can demonstrate whether he's understood the information. This is one thing that we can improve communication skills. Also, we should make the doctors aware of the patient rights. Patients in India, there's very little understanding amongst even educated persons about their rights. So patients must understand. Basically, some of the rights include whether what is the nature of the operation, what are the side effects, and whether there are any other treatment options, or whether he can take a second opinion. Also, there's whether he can whether there's a right to information about the drugs prescribed, right to grievance to medical counsel, so consumer courts. So these should be made. The students should be made aware of these rights. Also, students should be made aware of certain other alternative medicines. So holistic medicine, it works wonders in the field of preventing illness and chronic illnesses. And also, patients feel that these practitioners, they give them more attention, and they're more give it a more personal touch. But in India, it's unfortunately a dying science, because all the allopathy doctors, they do not give Ayurveda or naturopathy much importance. So this is where information therapy can play its part. It can bridge the gap between the two, and also so that the patient can have the best of both worlds. Other than this, the students should also be made aware of the methods of dissemination of information, which, as Ami rightly said, that it could be through printed materials like pamphlets, flashcards, or any pop-up books. Multimedia is more handy when it comes to rural or any illiterate population. The websites, the students should be made aware of the fact that they could disseminate information through websites, and websites are an effective method of self-education, so patients can be guided in the right direction other than the misguided by a lot of information online. So the students can be taught to create, manage, and also make websites, how to make websites more interactive. They should be taught these technological issues, because most of us, as they say, medical students are technologically challenged. Yeah. So other than this,
do you have enough on your syllabus?
we do, but we also, there are some second year or third year, which the initial 6 months are not as heavy as as compared to the final year. So these students are the ones we can tap into. So social networking sites are also otherwise students can be made aware of. And other than this, not only the undergraduates, also the residents should also be involved. Residents should be taught these basic rules, and also they should be involved in long-term care. So long-term care, they can be taught to how to teach the patient to do self-management of a chronic illness, or what are the regular prescriptions to the patient and the caregiver. For example, if there is a disease like diabetes, so the resident should be able to adequately inform the patient about what lifestyle changes can he make, or what prescription should he take on time to prevent dizziness, or how he should take care of his feet, or regularly monitor blood sugar and regular checkup. Also, what the registrar should be involved in giving them support about their decisions. So, which decisions about the tests, surgeries, what decisions to take, and also, as Kavya said, end of life care. So, emotionally sensitive information should be given at the right time to guide the family through its final days, to the patient's final days. I would also like to add that for the students, other than seminars and workshops, a better option should be a practical way. Students can be involved in themselves during their routine clinical postings to give information to the patients at the end of each OPD visit. So
She had a big problem with that, right? No one was interested in doing that.
okay, no.
It's to an extent. Anyway, she was more of sending it back with something.
Yeah, what I meant is doctors can be involved in giving the prescription, and students can elaborate more about the disease, its side effects, and in this way they are more involved in the disease and how to prevent it, how to treat it. So they are more. It also benefits them. Also takes the workload.
But how do you manage all this? There are what? 150 patients to see.
Right.
There are 3 registrars. You have to finish your OPD in 2 hours.
Yeah.
Your basic thing is just triage. Does this patient need hospitalization or not? Does this patient sick or not?
Yeah.
How do you manage all this? It's all counsel of perfection.
Yeah.
If you were the dean of KM Hospital, how would you actually implement any of this?
I would. Actually, there are side rooms in a OPD. So I have myself, when I was doing my research in liver transplantation, I had to counsel some of the patients and ask them about how they're feeling. So this was one of almost similar. So they used to ask me a lot of questions. What is going to happen? So I sort of played a role of a therapist, information therapist. So it was a nice experience. We could, in rotations, have students also involved. Like once a week is not a problem. In a clinical posting, it's roughly a batch of about 30 students. So say around 5 students if they do it every day.
Do you think medical students are a very underutilized resource in a place?
Yeah.
Why?
Definitely. We have.
Because they're lazy. They don't want to come.
No, okay.
I'm just asking.
Yeah. It's partly because in the initial years, like in the first year, second year, they are very ill informed. They themselves don't know what's happening, and it's a lot of information to take in. But as they get into their third year, their final year, they become more interested in the subjects, especially those who are interested in clinical subjects. You can tap them because they are usually quite interested in the subject, and they could be a source.
Why aren't they being? It's got to be 2 issues. It's either got to be the students themselves, or it's got to be the system which they work. They can't be a third issue.
Yeah.
So what do you think? Is it the students? Or do you think
I think it's both to blame. Yeah.
How would you solve it?
They could be They could be evaluated at the end of the year, or just I was thinking maybe one of the ways to assess them would be to see how they communicate with their patient while taking a case, or how they speak to the how they convey the.
You want to do me a favor? Why don't you do an essay for me on if I was the dean of KM Hospital, how I would engage the medical students.
Right.
It's obviously got to be good for the students themselves. Then I can see, but it's obviously got to be good for the patients. And you're always talking about how short-staffed you are.
Yeah.
Patients.
Exactly.
And maybe a medical student is not a registrar, but it's at least half.
Yeah.
And at least some of them, regular someone to work with.
Yeah.
Let me ask you one more question. What about information therapy for students? Do you think students are well informed? You talk about evidence-based medicine.
Yeah.
You think they ever read a journal?
No.
They just cram for the medical technique,
Yeah.
they pass the exam and then
Exactly. Most of them, there are.
How do you solve that? If the students themselves aren't very well informed, how do you expect them to, when they grow up and become residents, or they grow up and become practicing doctors?
Yeah. Yeah, true. But the students, they can be made aware of how important.
But I'm sure they know.
I'm not very sure if most of them know how because they learn from their.
True, absolutely.
Yeah. And most of them still, they just follow their seniors. So they see their registrars talking in a certain tone with the patients who are not well to do. So they just learn that, and then they just, whenever they become an intern or a houseman, that's how they speak. And it's a vicious cycle. It gets on